My name's Tom Brandon. I work at Moffitt Cancer Center. I'm the chair of the Department of Health Outcomes and Behavior. Okay, I'm a clinical psychologist by training, and my research area is on tobacco use. And I started the Tobacco Research and Intervention Program at Moffitt 19 years ago. Smoking is responsible for about 1/3 of all cancer deaths. So if we can help people quit smoking, we can help prevent them from ever having to go to a cancer hospital. So the reason I stay in tobacco research is because you really see you're making a difference as people. So as a clinical psychologist, I was trained to help people with depression, with anxiety disorders, and we do make a big difference there. But when I help people quit smoking, I can see the change within a couple of weeks. They're coming back in and they're healthier, they're happier, they have more energy, they're telling us how they can walk up steps again. And I also know that we're on average adding 8 to 10 years to their life. So it's that immediate feedback that really is rewarding. And since being at a cancer hospital too, I see the end point if people aren't able to quit smoking. And I want to make as many empty beds as Moffitt as possible. So there's so many things in life that you don't have control over. And that includes some diseases, and that includes cancer sometimes. But there are cancers that we do have a fair amount of control over. Lung cancer, my area of research, is one of those. Nearly all lung cancers, about 80%, are caused by smoking. So if you don't smoke, you've reduced your chance of lung cancer by 80%. If you quit smoking, you reduce your chance of lung cancer. We have a study, a big project going on right now, looking at low-dose CT scans to prevent lung cancer. This is a pretty new thing. A large clinical trial a few years ago found out that if you do these CT scans, these low-dose CT scans on people with a heavy history of smoking, you can prevent a great number of cancers. This was a big national trial, and now this has been approved for the first time just recently. You have to understand that for the first time we have actually a screening for lung cancer. We didn't used to have that. And lung cancer, unfortunately, by the time you experience the symptoms, it's often has progressed pretty far, and it's for many people it's too late. So now we can screen for lung cancer early on. Getting screened can be scary because you're afraid about what you might find. But I think you got to think past that, because if they do find something and they find it early, that makes all the difference in the world.